You know, AIDS is an awful disease. It takes everything, you know, somebody's dignity and somebody's health, and it's at a time in life when most people are doing their best work or building up to their best work. My name is Mary Ann Bush, and I work with the Visiting Nurses Association of Southeast Michigan, and I specialize in working with patients with AIDS. Good to see you. Yeah. See what your blood pressure's doing. Carl Hayes. I've been seeing him off and on for a year and a half. Yeah, it's 185 over 130. One of the hardest things with Carl is maintaining his blood pressure. You're way up, Carl. Did you do your dialysis today? The kidneys have a lot to do with our blood pressure regulation, and when they're not working, then you have to do it with the dialysis. Okay, I'll be back tomorrow, and we check that blood pressure.
She's one of the best nurses. Me and her have came very close, and just laughing and talking. You know, she's really became a good friend.
The fun part of it is that when I'm not the nurse that's seeing him anymore, he calls me at home just to see how I'm doing. And, you know, just talks for a minute and lets me know how he's doing. And that's kind of neat. Love you.
Thank you. Bye-bye.
Bye now.
Be sweet.
I get a tremendous amount of satisfaction from patients that when I come in give me a hug because they're glad to see me again. And, you know, people in the cast corridor that say, you know, they're glad I'm there, and if somebody wasn't down there, you know, they wouldn't have any of the care. What time are you going to go in to get that taken care of?
When I get some money.
Some money? The Cast Corridor project was started about 4 years ago. Many as possible. Come on now. That'll last you a couple of days. I carry a great big bag of condoms with me, and we give those away free. And I do testing for the HIV virus. They go right in here, do they?
Yeah.
You know, they're not going to go to formal clinics to go be tested. With the drug abuse down there and the prostitution, you know, this is a hotbed for AIDS to be spread.
Okay.
So
I need to go to work. You think I can have some conversation?
Yes. Everybody asks me if I'm not afraid down there, but I think it's fear of the unknown. No, because it's funny because the people will protect you. You know, sometimes I'm in there and there'll be a fight or a lot of swearing and yelling, and then somebody goes in there and says, "Will you shut up? The nurse is here." There are many people that feel that people that get AIDS either had to be bad people to begin with, you know, or they wouldn't have gotten it. Some of the people that I've met with AIDS are just some of the nicest people and the most courageous people that I've ever met. Are you scared?
Yeah. I'm scared am I going to be living around hurting and just in pain. And they have to just knock me out just to keep the pain away. Who's going to be there with me? I'm tired of being alone. I'm kind of alone up here now. I'm really sick of this.
Oh, honey, I'm sorry. You know, you might cry with them. I cry with my patients. You know, when they start talking to me, they start to cry that I should be strong and help them through it, but I usually end up crying with them, you know. And I guess it's all right.
I'd really be happy when Mary and them come around because then I have someone to talk to it about. Because my friends and family, they always want to change this subject because of the fact that I'm dying. They don't want to talk about it, but I need to talk about it.
If I could just turn back the hands of time, wouldn't have never gave us a chance. Never.
People need to be touched, you know, they need to be held, and they need to be known that they're worth something and that somebody cares. If I have a day where I see all my AIDS patients. At the end of the day, I'm exhausted. I mean, sometimes I think I couldn't see another patient because it's draining, and it takes from you, I guess, to give to somebody else.